My name is Amy Hasbrouck. I am the founder and director of Toujours, Vivant, Not Dead Yet. TVNDY is a bilingual, non-religious organization based in Quebec, but it's pan-Canadian. We are a group of people with disabilities and our allies who promote, who offer an opening for people with disabilities to participate in the discussion around assisted suicide, euthanasia, and other ending of life practices that have a discriminatory impact on people with disabilities. Because our experience as disability rights activists in the 35 years that disabled activists have been working on this issue is that this is an issue of discrimination against people with disabilities, and that we are subject to devaluation by our society, and that is some of the basis of the movement for assisted suicide and euthanasia. Now, some people might be thinking that why does EPC continue if euthanasia has been legalized in Canada? Well, there's there's a lot of reasons. First of all, the practice of euthanasia and assisted suicide needs to be monitored and overseen. The proposals that have been put out and the monitoring system that has been implemented for euthanasia and assisted suicide we've studied them. We do a weekly webcast where we talk about issues related to assisted suicide and euthanasia. We've done some analyses of the proposed monitoring program that has been in effect since last November. And what we've discovered is that the monitoring program is ineffective in detecting abuses, detecting ineligible people who are euthanized, and detecting violations of the safeguards. The monitoring system will not detect when people who are incompetent or incapable of giving informed consent are euthanized. It will not detect when people who are subject to external pressure are coerced or abused into requesting assisted suicide. And as I said, it will not detect situations where people who are ineligible because they don't meet all the eligibility criteria are euthanized or given assisted suicide. And I should say that in Canada, the vast majority of people are being euthanized. Very few, I think less than 10 people so far have requested assisted suicide, which is where they take the action themselves to cause their own death, whereas in euthanasia, it's the doctor who takes the action. And it's a little odd because people are talking about this is my choice, my autonomy, my life, my death, but they're giving over the power to their doctors. And all but a handful have given over that power, yet they're claiming this isn't a question of autonomy. So we have determined that there is still a lot of work for the Euthanasia Prevention Coalition and for Toujours, Vivant, Not Dead Yet. And so we have decided to collaborate on our next project. Now, in the medical assistance in dying law, there is a provision for the law to be evaluated after 5 years of being in place. And that process will start in June of 2020. By that time, more than 10,000 people will have been euthanized under Canada's medical assistance in dying law. That's a lot of people. And by that time as well, there will only have been one report from the monitoring system. Other than that, there will only be interim reports. And what we've seen from these interim reports, if you follow EPC's blog, if you follow our webcasts, you'll know that the interim reports have not given accurate statistics or complete statistics on the numbers of people who've been euthanized. And there are a couple of reasons for that. One is that there is no verification of euthanasias that are performed by doctors, because it's the doctors themselves that report what euthanasias they've performed. If the doctor chooses not to file the report, there is no way for that to be followed up. In Quebec, where euthanasia has been implemented since December of 2015, there is a secondary follow-up procedure, and that has revealed that doctors are not filing their reports on time, and that there are many doctors' reports that have never been filed. And in fact, even with the verification procedure that exists in Quebec, they have, in the first 3 years, found 20 cases of euthanasia that were not caught by either of the two verification practices for determining that someone was euthanized. So they found some euthanasias that happened that were not reported either by the doctors or by the institutions. So we know that there are euthanasia happening that have not been reported. We also know that there are euthanasia of people who are not eligible. And further, we know that there are many cases that have not even been evaluated by the by Quebec's Commission on End-of-Life Care. So they had a backlog as of a year ago of more than 100 cases that they had not evaluated. And that is, then you have to add the estimated 1,500 euthanasia that took place between April 1st of 2018 and March 31st of 2019. So we know already, before even the first official monitoring report from Canada's Ministry of Health, that there are that we don't have adequate statistics, that euthanasias that are happening are not being reported, and that ineligible people are being euthanized. So part of what we plan to do in response to this 5-year review that is going to begin next June is to try to gather information that is not going to be gathered by the official statistics. So the official statistics are only going to gather the postal code of the person, and some other very basic information, not even race or other demographic information. It's only going to get a very limited perspective on what the person's reasons are, and that is just a checklist. It's not self-reported, it's reported by the doctor, not the individual. So there's not going to be enough information to have an idea of why people are asking for euthanasia, what their needs are, whether their needs are being addressed, whether they are receiving palliative care, whether they are receiving the supports they need to live in the community. So all of those things are missing. That one report will have come out by June of 2020, and yet Parliament is expected to make its decision and evaluate the program based on that one report. So our process is to provide further information on that. And one of the things that we did is we came up with a questionnaire and circulated it to activists who are concerned about this issue. And we asked several questions of the activists about the program, and we have a brief summary of what people said. So one of the first question was what were people's greatest concerns about the first few years of implementation of the medical assistance in dying program. And the first was that there is a need to offer alternatives to assisted suicide and euthanasia. That the promoters of MAiD are saying this is a question of choice, but people don't necessarily have the choices they need. Most people don't have access to palliative care. Many people, because of the public policy that directs people toward institutions rather than care in their own homes, are forced to live in nursing homes, whereas they would prefer to live in their own homes. So people need alternatives to assisted suicide and euthanasia, effective palliative care and home care. Also, assisted suicide and euthanasia are being normalized. It's being promoted by government, healthcare professionals, and the media as the go-to solution and the only good way to die at this point. And those are problems that need to be addressed both in public education and with the government. There needs to be action taken. We've already written to the CRTC and the Ombudsman, but have had no response from them in terms of the unbalanced coverage of this issue in the Canadian media. So we need to continue with that process. Also, doctors are being pressured to provide medical assistance in dying, and hospices have yielded to the pressure to provide assisted suicide and euthanasia. And opposing assisted suicide has become a fringe position. People are reluctant to speak out against it, and the mainstream opinion is that MAiD is a good thing and it's the best alternative. Another concern people talked about was the lack of accurate reporting and monitoring. People talked about the pressure to relax restrictions, such as the 10-day waiting period. People also talked about the liberal interpretation of the reasonably foreseeable death criterion. There was a decision that came from an Ontario court in 2017 that said that it wasn't necessary for the doctor to stipulate a particular amount of time, but in that case, the person wasn't expected to die for another 10 years. So the reasonably foreseeable is a very wide open concept because of that decision. Suffering being subjective, it is defined very broadly. There is intense pressure to expand eligibility. There has been erosion of trust between patients and doctors have felt intense pressure not only to provide medical assistance in dying, but also to refer people for that. And people do not have a safe place where they know that they will not be pressured to accept medical assistance in dying. Some of the, we got a variety of responses to our questionnaire, and if anybody is interested in those responses, I'd be happy to send that information out. I don't think it's necessarily productive to go through the whole thing here. But one of the projects that we have in mind, and we have begun, is to collect data about what is happening to people. And this is a fairly broad perspective on what's happening to people. Both people who've requested medical assistance in dying and people who have been pressured to request it, or people who have been pressured to accept do not resuscitate orders, to refuse medical care, food and hydration, or artificial food and hydration, meaning intravenous nutrition and hydration. And this is one thing that Alex had mentioned in a meeting earlier today, that this idea that people are being pressured to refuse food and fluids is an issue that is tracked in Quebec, but it's not tracked by the federal monitoring system. And this is something that we need to start tracking. So we have developed a very preliminary, because we are not professionals at statistical analysis or data gathering. We've created a preliminary information form, and we've started to record data about some of the people who've had some of these experiences. Either they have sought medical assistance and dying because of reasons that are unrelated to death, because they needed home-based supports and couldn't get them, because they needed palliative care and couldn't get it, or because or they were just being pressured to accept do not resuscitate orders. And we're starting to collect this information, and we need more people to come forward with their stories. And we also need more medical professionals to come forward with their stories about being pressured to perform medical assistance in dying, or even to do referrals for medical assistance in dying. And what we are hoping to do is to record the kinds of information that will not be tracked by the federal government's monitoring program, to demonstrate our concerns to Parliament when this review happens, to be able to document and not just have a few anecdotes, but have a more systematic database of information about the problems that we presented. So I am going to ask my assistant policy analyst and outreach coordinator, who is on her way, to come and speak with you about some of the work she's been doing, looking at the concerns people have had regarding medical assistance in dying, the data she's gathered so far.